Doctors that own their own medical equipment overprescribe tests
That's what the Duke study showed in the Journal of American Medical Association.
by as much as 50 to 100% more.
Well, let's figure out why. They order more tests, they get paid for them, they're going to make more money. If you've got an investment in some kind of medical equipment, there's a lot of money that goes into that. And you want to get reimbursed.
And plus, it's more convenient. It's right there. Makes it easy for them to order it.
Exactly.
And then if they interpret it, they get paid for that too.
Well, that's right. So what we have is a system here where there's a conflict of interest. And we have to watch things like that because we know that when something becomes a business rather than just a service, that economics have a lot to do with whether or not you're going to do certain things. So when it comes to testing, I mean, doctors invest in all kinds of things like MRI plants or MRI facilities and CT facilities.
Lab tests and echocardiograms and,
right, and these
imaging.
Exactly. And they even have special places like surgery centers where they're investing in that, and there's a return on investment. So the doctors all tend to refer their patients to the place where they have the need for more business.
Well, and doctors are probably wanting more money since the HMOs took over their practices.
Well, we all have our problems, but the big thing here is that medicine's become a business rather than a service.
So you need to be careful when your doctor orders you a test. Like maybe a good idea is to find out if he owns it.
Well, you may not care, actually, if you're an individual, because your insurance is probably going to pay for it. And nobody's going to know whether it's overprescribed or not. The examples where we do know things like that is, let's take the example of the oncologists. The oncologists make 1/3 of their income from the sale of their chemotherapy drugs. Now that's something that is a real conflict of interest.
That shouldn't even be allowed.
No, it shouldn't. But that's the way the system is. Big Pharma wants it that way because they want to sell their new designer drugs that cost an awful lot more than the ones that have gone off patent.
It's like just taking advantage of people when they're down, you know. They're sick and they're desperate and they want to live, and
Exactly.
they say, we're going to give you this drug and it might help, and we're going to charge you $100,000
For a year of treatment? Yeah, they
Yeah.
might. And for the doc to get $33,000 of that, there's something wrong with that picture. So we need to separate these the best that we can. And we don't want to just have conflict of interest run what we do. And some of the time you can understand where the doctor's coming from. For example, with the echocardiograms or the nuclear imaging that we do to assess cardiac function, those tests may be expensive, but after you've done a procedure, like put in a stent or done a coronary bypass procedure, you'd kind of like to know what the answer is as to did the thing really work? And so you might order these tests, and your patient, of course, is eager to find the results too, because they'd like to know. But the American College of Cardiology has already done an evaluation of this, and they say that there's no change in morbidity or mortality whether you do the test or not.
And don't doing tests sometimes lead to doing more tests?
All the time, you know,
Maybe
you find things that
aren't necessary?
you're questioning, are they normal? And it leads to doing another test and another test and another test. I mean, one example of it really getting out of hand has to do with what I went through about a month ago when I had a problem with my hip. A surgery went bad, and we wondered if it was infected, so we had to do an aspiration of the joint fluid. Now, a few years ago, I had just gone to my orthopedist. He would have got his needle out, put a little numbing in there, and taken some fluid out and sent it to the lab. Cost me $100, or my insurance company $100.
Now it's a huge deal.
Well, yeah, they've got centers where they do things like this. So you go to a nice building where you're met by a gracious staff, and a nurse comes to get you, and they take you to a private room where they go on ahead and start an IV. They start an IV, which you don't really need.
And then they offer you some sedation, heavy duty.
Well, they may give you something like an anesthetic if you want it. You want a little Versed, sir? That'll make you not feel any pain at all. And I'm thinking, Versed? Anesthesia? They're doing a needle aspiration of a joint fluid. It's not that uncomfortable, particularly for me when I've got a problem that has to do with a metal joint. So when we're looking at these kinds of problems, we have to make a careful assessment. Do we really need to get this expensive? Does there should doctors have the ability to buy into businesses that depend on their referring their patients to make profits? And the answer is, you could if it wasn't a business, but because it's not a business, probably a bad idea. The
They
same
just
thing.
turned out to be money machines.
Well, they're not just money machines, but they are money machines for sure. I mean, would you like to have the comfort of a place like that? The answer is yes, of course. But with healthcare expenses getting out of hand, is that the best way to spend your dollars? The answer is obviously not. So we need to reassess what we're doing, pay attention to the costs that are involved, keep the doctors out of the business of medicine, and have them to provide the services that they provide as economically as we can so that the healthcare system doesn't go bankrupt.